We're, of course, hearing very dire descriptions of this fourth surge of COVID hitting the metro area and the state.
But there are some glaring differences compared to the previous waves of cases. Tan Trung puts those differences and the responses to them in focus tonight.
This is the French Quarter in the initial months of the pandemic. Here it is this month. The fourth surge of COVID began sweeping the state as most of it moved ahead with reopening. And Doctor Susan Hassig says the results are disastrous on a Titanic level.
The ship is hitting the iceberg and, we're still having dinner.
From the highest office in the state to the crowded hospitals, this fourth wave of COVID is described as the most severe of the pandemic. And the record-breaking pace of hospitalizations is the key measure.
Why are we seeing this particular surge of cases and hospitalizations now?
Well, because when we had an explosion like this before we went into lockdown, and people were forced to stay apart to a very, very large degree, that's not happening now.
Here's a state chart showing when that did happen in March last year. After the statewide stay-at-home order took effect, COVID cases stayed relatively low. As phased reopening began, cases increased. Even after the introduction of vaccines, we saw another surge. And now the Delta variant is rapidly driving up infection, including in children, which we didn't see previously.
The speed that Delta moves has ripples and ramifications that go beyond just the fact that lots of people are getting infected.
So far in Louisiana, it's not the deadliest time of the pandemic. Take a look at state data on COVID deaths. On the left, you'll see deaths were highest in March 2020, before vaccines. On the right are the deaths this month. But Dr. Hassig cautions against assessing this fourth wave through deaths alone. She says all the focus hospitals must currently put on COVID is taking critical attention and care away from other patients.
Delaying care for cancer patients, delaying, care for cardiovascular disease patients, delaying care for people with kidney disease. All of that has long-term, again, ripple and secondary effects.
We've repeatedly heard that vaccines are the best weapons against the virus, but all the regions of the state are below a 50% vaccination rate. 2 are below 30%. Keep in mind, it can take vaccines several weeks to offer full protection. And even if everyone in Louisiana got vaccinated today, Hassig says this fourth surge is likely going to be with us well into September. The CDC projects new cases in New Orleans to peak near August 20th, but it's unclear if that would necessarily put us out of surge status. What's hard to deny are the controversies surrounding masking and Louisiana's lagging vaccination rate. As long as those last, Hassig says you can better protect yourself by limiting close contact with other people.
We as citizens of communities that are really being battered by this virus, we need to rethink perhaps what our choices are.
As we've seen in previous surges, individual choices have broader consequences. Tan Trung, Eyewitness News.
Dr. Joseph Cantor, Chief Medical Officer in Louisiana, told the State Board of Regents today that if cases don't peak in the next 2 weeks, more aggressive COVID guidelines might be needed. The current statewide mask mandate is in place until at least September 1st.